Hello, Dr. Brandon.
Hello, Dr. Morgentaler.
How great to be with you.
Oh, the pleasure's all mine.
So we've got another episode of the Sex Doctors today.
Yes, we do.
And I think we've got a good topic today. I got an idea. Why don't we do low libido in men?
Oh, that's brilliant. Brilliant topic.
All right. So libido, sex desire.
Before we start, a small disclaimer. The Sex Doctors podcast is not a substitute for medical or psychological advice.
Some men come in and they don't have it.
They don't have it.
Or it's way down.
You know, I've been writing a Psychology Today blog for almost 6 years now. And this is one of the more popular topics, the blogs about men with low sex drive. And I'm guessing it's because A, it's common, but B, people don't necessarily know where to get advice about it or help.
Right.
So it's kind of this like shame-filled secret thing that really people are, I think, needing and wanting advice about it.
Yeah, that's good. Yeah. I think it also gets confused, by the way, like by if somebody isn't engaging in sexual behavior much or initiating or seems interested, that's not necessarily low libido.
That's true.
Right? So low libido refers to the drive that's inside the head.
Right.
Right?
Yes.
And so I often say to my male patients, you know, when they come in, it's like we're talking about the grr baby, right? Like it's hard to put in words.
Well, you would say it's the drive in their balls. Wouldn't you say that?
No, I don't think guys feel it in their balls.
Okay.
They may feel it nearby in something else, but they may not. I don't think they feel it there.
Okay.
But the reason I say the grr is it's a non-word thing. It's a hunger.
Yeah, that's fair.
And it's completely distinct from men who say, "Oh no, I have interest in sex." And what they're talking about is they think that their relationship would be better consciously, rationally, if they were having sex. They want to have sex, but they don't have the drive for sex.
Yeah.
There's an important distinction there.
For sure. And I will ask people if they're masturbating, because if they're masturbating, it's probably not a libido issue, right?
Right. Exactly. Yeah. So the drive for sex includes masturbation.
Yeah.
Right? Yeah. But what I was getting at also is that for the partner of the man, the fact that he doesn't seem interested in having sex with you isn't necessarily a libido issue.
No. Yes.
It might just be manifesting as they don't having much sex or he doesn't seem that interested.
Right. Sure enough.
But the partner doesn't know whether his hunger for sex is still strong, just not with her or him.
Well, right. So two questions that I think sort of go along with understanding if it's libido or not. Are they masturbating?
Right.
And is the person that they have to have sex with the person they want to be having sex with?
Right. Yeah. Or when they come to me, if the history is, if what they're saying is not having sex much, the question is, do you have a hunger for it? Like, do you think about sex? Do you fantasize about sex? But in some ways, the most simple thing is to ask them, well, I'll tell you a little story. So when I started out, I was taught and I knew it was important to not be shy about asking people, taking a sexual history.
Are we talking like right out of medical school?
Yeah, out of training, right? And I was supposed to I was involved with, I was dealing with male infertility, male sexual problems. So I needed to get to those questions. And I thought the easiest way to do that was to ask them first, so do you masturbate? And guys hated that question.
Well, they thought it was so stupid. Of course I masturbate.
No, they squirmed. They didn't want to answer that question. So you, Dr. Brandon, you are completely like this is like just what you talk about, right? And you are, let's just tell it like it is. That's who you are. But you know that a lot of people are really pretty uncomfortable around sex.
Yeah.
They don't want to answer anything about it. And what I realized is that it was a terrible first question around this issue.
Oh, like threw them into the deep end of the
because the guys didn't want to admit there was shame associated with being a masturbator.
I see. Well.
So the question that I asked as I became more evolved was, which I think is still the best question. How many times a week will you ejaculate?
Oh, that's good.
I'm not asking them what they're doing to get there.
I like that. Yeah. Yeah.
Yeah. And, and if they say if it's less than once a week, something's not right.
Mm-hmm. And you would say that in your mind, less than once a week throughout any age man.
Yeah. Now, right.
Which is an important point.
Yeah. Now, some men obviously will do it, especially the younger guys can do it 2 or 3 times a day. Mm-hmm. A lot of guys might do it daily. But, as people get older, sometimes there's just not the opportunity. The drive isn't as much, even with everything normal. So 2 to 3 times a week might be fine. But if what gets below once a week, that's not right. There's something that's really wrong.
Right. And it may or may not be a libido issue, because if they are saying they're not ejaculating every week, it might be because they're not happy with their sexual function, right? And so they're just not.
Yeah, but those men can still ejaculate. They can still have a drive to do it. So, so just to clarify for our audience, some men who can have ED, erectile dysfunction, they can't get a good erection, they can still have an orgasm.
Yes, right. Clarify that. That's
yeah.
Right.
Even though their penis doesn't get hard, they still have the nerves are unaffected. The hardness of the penis, the firmness, has to do with the pressure within the 2 chambers, the erectile chambers of the penis. It's a blood flow issue, and not just blood flow, but you have to be able to trap the blood in there, which is on the venous side. So that's how you get an erection. But the nerves that make things feel good and that lead to the sense of an orgasm are unaffected by whether the penis is hard or not. And so this is a misconception that men who can't get hard don't have orgasms. No, they do. Mm-hmm. And they can. One other little clarification is that orgasm isn't the same as ejaculation. So ejaculation is actually the expulsion of the fluid, right? But there's some men who have neurologic problems. Some men after radical prostatectomy surgery for prostate cancer, pretty common these days. The nerves are interrupted, and so the flow and the prostate is gone. The fluid can't come out, but the sensation of that release, that marvelous feeling, the orgasm, that's still there. So orgasm is the experience. Yeah. Ejaculation is the fluid coming out.
And in Tantra, if guys practice Tantra enough, some of them at least learn how to manage their ejaculate so that they can have an orgasm and not ejaculate. And you learn it more like from a guy's perspective energetically, so that you kind of like allow that energetic release or that energetic sensation in your body so you feel it, but it doesn't result in an ejaculation. It's very fascinating.
Yeah, it's fascinating. I've read that. I do have some questions.
Do you now?
Not for you now, but when I've read and heard about some of the tantric techniques about that, I say, really?
Oh, actually, really. I thought it was all a bunch of hooey myself, and I found myself through my own naivete in a sort of tantric sort of learning situation.
Oh, yeah.
And it's a thing.
Okay. All right. Yeah. But well, we don't have to get too deep into it, but what I would say is there are women who believe that they've had orgasms until they have their first real orgasm.
Oh, I see. Well,
and then what they realize is that they had some pleasurable experience that felt like it came to sign until you actually experience. I'm not saying this is the same.
Going off track here, but there are.
This is good. This is good stuff.
I mean, there are.
Okay.
In different parts of the body. Like back to that tantra stuff.
Oh, yeah. So we're not going vaginal versus clitoral orgasms, are we? No. Because some people can get them from their elbows.
You can have these orgasmic sensations.
Yes.
Outside of your pelvis.
Yes.
That feel like orgasm.
I believe that.
It's just wild.
I believe that.
But I think it requires, probably for some lucky people, they just sort of found they can do this. But for most people, it requires some practice and some focus. It's like almost a meditative experience.
Yeah.
But, I actually, when I'm working with couples who, are just looking to expand their sexual experience together, they've been together for a while, a little bored, not sure what to do. I'll suggest they look into possibilities around learning tantric techniques. And I suggest they go tread carefully into that experience, because people call it tantra, and it's a whole different, all different kinds of things.
Yeah.
Some of it is just a group of people looking to have sex together. Some of it, people really very seriously learning.
Oh, very serious.
To master.
Yeah. So I don't mean to minimize it at all, and I know it's really important to a lot of people. I just wonder, though, on a biological level, whether sort of the retained ejaculation, if you will, whether that's an orgasmic type experience, just like what you were describing, that can be outside of the pelvis. But biologically, I don't know that that's exactly the same.
And we've gotten so far off from
what were we talking about before? Libido.
We should probably get back to it.
Yeah, good. Let's do that. Yeah.
So I do think there's a lot of shame for guys involved in a low libido. And
right.
We put a lot of shit on people about sexual concerns and dysfunctions anyway, but we do have a little more space for female low libido, I think, in our culture than we do for guys having a low libido.
Oh, for sure. Yeah. It doesn't fit the stereotype for men.
Right.
Men are supposed to always want it under all circumstances, always ready to go. Yeah.
I think they have a
little breeze goes by and they say, that's all I need.
Right. And guys get exhausted too, or they're on medicine that works against them. Like all these things, stress closes people.
For sure.
And that can affect a guy's sex drive, just like it can affect a woman's sex drive, or taking an antidepressant can do it. Like all these very common things can interrupt a guy's libido, just like it can a woman's.
Yeah, no question. I had a patient once, I may have even mentioned him before on a previous podcast, but it made a big impact on me. The guy came in, his issue wasn't libido necessarily, but ED. He was married. And as we talked, it turned out that he only had this problem when he was in the city. Every weekend they had a country place he and his wife went to. And when they were at the country place, sex was fine. And he didn't realize what he was saying as he was telling me that stuff. But as we talked about it, like he realized that, in the city during the work week, he was always consumed by thinking about his work and job. And there were things that had to be done at night. Yeah. And so he couldn't get away. And on the weekend was his sort of safe place. He tried to not do work and he de-stressed and everything worked. Yeah. So for sure. So I can tell you what I'm thinking of and what I go through when I see a guy who comes in who's got low libido. So to me, I'm always thinking, how much of this is psychological? I don't mean that in any negative way, but sort of, stress, depression, whatever. Yeah. And how much of this is physical? Because I'm thinking about what am I going to be able to do about it, right? So I'm trying to kind of put it into categories. And so, the questions are often about how's the relationship, how's work, how are you doing? And, are you depressed? And often you can tell because low libido can happen, just as you say, depression, stress, anxiety, and certainly relationship issues, right? And something that you brought up before, I just want to mention, I'm not sure I would call it low libido exactly, but some guys, if they don't feel like their sexual equipment is working properly, they have a reaction to it. Like they don't want to be put in that situation. They're not thinking about it like, oh my God, I don't want to be in that situation. But part of their brain is protecting them from getting into that situation that they find embarrassing or shameful.
Right, like they can't get an erection.
Right. And so you can kind of get at that too, but I think usually what we're talking about with low libido is where the equipment is working. Yeah. Right? Yeah. So that's separate. It's an important distinction. So there's the sort of stress, anxiety, depression kind of symptoms, whether the rest of the equipment is working. And so that's one category I'd call sort of, and if anything shows up, that's what we're thinking, more psychological. Medications are huge, huge. Yeah. And the common offenders, the common ones that cause problems are the antidepressants, the classic stereotype of the SSRIs, which can make it so men have less desire, worse erections, and often inability to have an orgasm or a lot of work to have an orgasm. So it's not just one thing, but a lot. But
you're kind of fucked either way on that one, because depression can cause low libido too. It's actually a symptom of depression, a low sex drive.
Absolutely.
So it's sort of like you don't get treated. You could have low libido because you're depressed. You get treated, now you have low libido because of the antidepressant.
Oh my God, then you're really in a problem. Because you get the SSRI, you might not be depressed anymore.
Right.
But you still have low libido.
Right.
But it wasn't what it was before. Now it's probably from the medication.
And you know what else I think can fuck with some people is that it can take a while for the sexual side effect to kick in. It's not just like they take a pill and all of a sudden they have no libido. Like things just take a little time to get sorted out in the body. So they started their medicine 1 month, and then in another month or two, they start to feel a sexual side effect. They don't know if it's related or not.
I'm so glad you say that, because there's a classic one in my field of urology, which is there's a medicine that we use called finasteride, and a related one called dutasteride. And they're used commonly in urology to shrink the size of the prostate. So if a man's waking up at night a lot, it's a common drug that people use, and it's reasonably successful. It's not amazing.
It's used for hair loss too, right?
And in low dose, it's Propecia.
Yeah.
Yeah, finasteride. And one of the known side effects of these medications is that they can reduce libido.
Yeah.
And especially the young guys, there's some really awful cases where some of these guys take one dose and they're never better again.
And I have seen multiple studies about that.
Yeah. And they've often been dismissed as, it's just psychological and stuff, but I think it's real. And so there's that. But what's interesting, so if it happens right away, known problem, in the vast majority of cases, you stop the medication, things get better. Mm-hmm. The confusing part is when it's delayed. Mm-hmm. And then what happens is the guy comes in, he has low libido, he's on a medicine, let's say finasteride. And I say, well, the finasteride could be doing it. They say, oh no, I've been on it for 2 years.
Yeah. And
it doesn't, as a time relationship, doesn't make sense, right? We think that the side effect should happen soon after I start it. Mm-hmm. But I don't know, I'm certainly better than half the time when I'm faced with that.
Yeah.
And I have the guy stop the medication, they get better.
Mm-hmm. Isn't that wild?
Yeah. So it can be a delayed effect.
Yeah. Very complicated.
Yeah. And then of course, the last thing for me that maybe I'm thinking it's like I leave it as the last thing to rule out, but we're going to check for it anyways, low testosterone.
Absolutely.
Yeah.
Well, that's like the first thing in my mind.
So that's the classic thing. Mm-hmm. Yeah. But even if a guy has low testosterone, the reason I think of the other things, I'm not saying I think of them first, I'm thinking them all of them at the same time. But if somebody's depressed or having a relationship issue, mm-hmm. even if his testosterone is normal, it may not solve everything, right?
Mm-hmm. Mm-hmm. True enough.
So we need to look at the whole person.
Right. So if he's depressed, and I'm worried about, first off, I try to rule out, like you say, you start by ruling out emotional stuff to see what you've got to work with. Yeah. Well, I try to rule out physiological stuff to see what I've got to work with.
Yeah.
So one of the first things I ask them to figure out about their testosterone level is, do they wake with morning erections generally?
Perfect.
Because that's like an easy, not necessarily easy. For many men, when their T level's low, they will not have consistent morning erections, right?
Right. Right on.
So viewers
Very
can
important.
think about that too. Like if they feel like their libido's low, are you waking with a morning erection? If not, you probably should go see your doctor.
Morning wood.
Yeah. So anyway.
Right.
So you're looking at testosterone levels to see if that would help.
I'll always get hormone levels in guys who come in with some sexual symptoms.
And so what about, so there are medicines that are marketed for women with low libido. They're prescription medicines. But very controversial, which we should probably do a show on those because we know.
Yeah, less controversial now.
Yeah. So anyway, would you suggest any of those off-label to your guys?
Well, how interesting.
Yeah.
So I would just say that it's in 90% plus of men, if they have low libido, we know what the cause is, right? And often we can treat it. So medications, I said psychological, use the term emotional causes. I like emotional better. Usually you can tell that. You don't need like 5 sessions to figure out whether somebody is depressed or having trouble in their relationship. We know if it's low testosterone, and we know what the common problem medications are. So it's possible that some guys have everything is fine. Their testosterone is great. They're not on any medications, let's say. Their relationship is great, work is great, and their libido is down.
Yeah.
And that's a tough problem in men.
Yeah.
Not that common, but it does happen. And I have used, so the medication we're talking about is called flibanserin. Its trade name is Addy, ADDYI, and it's an on-label indicated treatment for women who have low sexual desire, hypoactive sexual desire disorder.
I worked my ass off to make sure that thing came to market, if I may say so myself.
Yeah, you were on the scientific advisory board for the FDA.
Twice. Yeah.
Twice for that.
Yeah. So it can be very helpful for women, a subset of women, not all women. But, they're exploring it now for men too.
Yeah. And listen, it works for men.
Yeah.
And it's original data. I saw some of the data that was sort of just when they were first developing this drug. I think it was first supposed to be an antidepressant.
Yes.
Right? Yeah. And it works on the dopamine centers. And the first studies were in both men and women.
Oh, I didn't realize that.
And the men responded beautifully to it. Small groups of men, early data. But at some point, they decided to deal with women exclusively. But we've talked, men and women, our hormones we have the same hormones in different values, but we got the testosterone and it does the same thing for both of us. And our brains have more similarities than dissimilarities, I would say. So it makes sense that a drug that would work in a woman to increase desire would work in men too.
Or could, potentially.
Or could, yeah. Listen, there's no drug that's 100% effective. That shouldn't be a criticism of a drug.
And so they are using also bremelanotide, aren't they? Off-label for guys? Or?
Yeah, for guys. So whatever's available, as long as it's available for women, for somebody, you can use it in other people, and people will try that. Yeah. I haven't heard very much about that. That's the injection. Yeah, called Vyleesi. Yeah, but I think there's trouble with availability of that drug now, and most people would prefer to not take an injection. Addy or flibanserin is a pill. You take it every day. It can take a month or so to kick in, but a pill's easy for people.
So tell me this, if somebody wants to try out Addy himself and he goes to his doctor and his doctor says, where the fuck did you hear that nonsense?
Yeah. He heard it from the sex doctors.
Well, yeah, but how does he find someone who might be willing to try that off label?
Yeah. So you can find it. Well, listen, so some of, not so easy.
Yeah.
You need a doctor that's interested in sexual medicine. Many of the larger urology group practices offer that. There's usually somebody who's identified, and some of those guys might be willing to prescribe that.
Or else I would tell people to go to the website of ISSM.info. I think it's .info.
Oh yeah.
The International Society for Sexual Medicine, and those folks are very into all ways that can get someone to roam. Right? Yeah. And so they may be...
That's a great suggestion. And the North American cohort from the ISSM is called the Sexual Medicine Society of North America, SMSNA.
They're giving you an honor,
and I don't know if that's official. And they're... now maybe they'll withdraw it now, but I don't know. Now that we let the cat out of the bag. And their website is smsna.org.
Yeah.
And you can find providers there geographically. So there may be somebody in your area that might be willing to entertain that.
And now, you might find someone within your state. You don't necessarily have to show up in their office, but in your state to get help. So.
Yeah. And you can tell them if they don't know anything about this, you can say, you heard about it from Dr. Morgentaler and Dr. Brandon.
Yeah. Yeah.
Yeah.
So anything you would add to your patient who comes in to see you for low libido, anything else you would be thinking?
No. So listen, so if it's low testosterone, if he's got low values, I'm going to treat him with testosterone. If he's on medications, that I think might be problematic, I want to take him off it, but that can be tricky, right? So if it's something that's not critical, like he's on a medication to help with his urination, most of these guys, it's not like an amazing result with this. They can stop it for a while and see what happens, and usually will. If they're on an antidepressant, it gets complicated, especially if they're under the care of a psychopharmacologist. I'm not going to take them off of that medicine. I'm going to tell them to discuss it with their doctor, whoever's prescribing it. And, and that varies. There's some people who've had major depressive episodes, suicidality and stuff. You don't want to mess with that. No. But there are other people who do it for anxiety or whatever. And often the doctors can change their medications. There's some that are less problematic than others.
And there are newer, not just newer medications, but newer ways to treat depression.
Yeah.
That are medication free.
Yeah, cool.
Like electrostimulation of the brain that are really worth people trying if they feel like their antidepressants are dragging them down more than helping.
Now, Dr. Brandon, let me turn the tables and ask you.
Yes.
So you see this too.
A lot, actually.
So what's your approach? Let's say you have a guy, maybe he's part of a couple that you're dealing with, and he's checked out. Like his hormone levels are okay. Maybe he's not on any medication. Let's say you've referred him even to a urologist, a sexual medicine doctor. They say, I don't know. I can't figure it out.
So I'm thinking one of the first things I start to explore with him is where in his life he might be feeling disempowered. Because if he's feeling disempowered somewhere, that's chances are getting acted out in his experience of sex, and his experience of his libido. So just by disempowerment, I mean, like, is he feeling disempowered in his life somehow? And that's like sucking the vitality out of him. Is he feeling like disempowered at work? Did he just lose his job? Is his boss treating him like shit? Is he feeling disempowered in his relationship? Does he feel like he has not a say there? Or does he feel like he's disrespected in his relationship? Or maybe it's just in the bedroom. He just feels like he's lost his mojo in the bedroom in particular, like for whatever reason. So I'm looking for that element of feeling of disempowerment. I'm also like thinking, is he disconnected from his body, just like disembodied, really, just so focused in his head all the time, and like we all are doing so much time on technology and whatever we're doing in life that's taking all of our energy, that he's not even in his body to feel his libido. So that's a process usually of getting him back into his body in a regular way. Like exercise with other men is also good because it kind of amps up that sense of competition. Guys can get like, that can kind of like help what seems like his testosterone level, although I don't know that it does, but it just sort of gets him into that space more. But also things like meditation that'll get him in his body, things that'll get him out of his frontal lobes and feeling his physical self. So that's an important part.
Very interesting. Do you ever suggest watching porn?
Oh, I do. Oh, yes. Because also, and that's always part of the suggestion, is that like he's kind of probably lost what turns him on. He wouldn't be in my office if he had enough contact with what turns him on to make his sex life work the way he needs it to. So he's probably lost touch with what turns him on. So yes, absolutely. I send him to porn. And there's a book I always recommend, which is A Billion Wicked Thoughts by Ogas and Gadam. Love that book. I've loved that book since it came out in 2014. And basically it gives people, I think, permission to like what they like, because it really covers how very vast people's sexual interests are and sexual fantasies are. And I think sometimes people can become very critical of themselves. They don't like what maybe they need to think in order to get off whatever. So they shut the whole mechanism down. Right. And so this is about like him giving himself permission to watch whatever porn he wants to watch. And I talked to him about like, if he's in a relationship, like I'll talk with the couple about this, like this man needs a little space to figure out what gets him going. So let's stay out of his way. Like, let him have some porn. Let him watch what he watches. Don't get involved in it. Let him have his own private sex life again. Mm-hmm. And that can help him like stir up his own internal pot till he has enough reserve then to bring it to his partner.
Love it.
So I try to give him space.
Yeah.
And we all stay out of it. Like, let's all read that
I
book and let's all stay out of it.
I love it. You know what I think that the kind of the way we regard porn has to change, right? So
It's so complicated.
it's
Oh my
complicated.
God.
It's complicated, and we tend to make things overly simplistic, right?
Yeah.
So we tend to say porn is bad or porn is good, like, and certainly there's some parts of it that are very negative.
Yeah.
But you heard it here, folks. Is Dr. Brandon, sex therapist, clinical psychologist, sometimes thinks that it's helpful
Yes.
for individuals to look at porn as part of the therapeutic regimen.
Yeah.
Yeah.
He's got to find for this man that we're just,
And it makes total sense.
yeah, he's got to find his way sexually like that.
And I think, most guys would recognize some of what you're saying, which is that most guys have gone through periods where sex is like top of their minds all the time, and other periods of time that may last days to weeks to months where everything is fine, but it just doesn't have that same kind of rawness to it, right? They're not thinking about it. And it's often triggered by having something that experiences you've had maybe, or a new partner, or something you're doing with your existing partner that keeps giving. It's the gift that keeps giving, or the opposite, where there's just nothing that's going on, and so it all just feels the same. Yeah? So like begets like. Yeah, it sort of self-perpetuates if they can get in that area.
Right. So your advice then is in this situation?
I love what you're saying. What it reminds me of is I once did a kind of a debate about sex with a clinical psychologist. It was in front of a big audience, sexual medicine audience, and I spoke first, and I talked about our various treatments for erectile dysfunction, and then he gets up and he told the funniest line. He says, "Well, this is the difference between a urologist and a psychologist." Says the urologist sees a patient for 5 minutes, decides he needs Viagra. Here it is. Say, I talk to the patient for 45 minutes to an hour, and I find out that the patient hates his wife.
It's funny. Not
And
funny.
so Viagra isn't the answer.
Yeah.
No, I thought it was funny. Now, it may not be funny. It's not funny for that couple, but it's a joke. It's not a real couple. So, yeah, it's funny.
Yeah.
It was good. Yeah, people laughed. And the reason I mention that is that what you just covered is a level of understanding of what sexuality and drive is that frankly doesn't exist in urological training, right? And sort of in the biology-based medical model, right? So how great to have this conversation with you.
It's an important one. And I'd be interested too. We're just, by the time this airs, our website will be up and running, the Sex Doctors Podcast.
What's it called? What's the name?
The Sex Doctors Podcast.
.com.
I believe, yes.
Sexdoctorspodcast.com.
Well, anyway, yes. And so I hope people
Sexdoctorspodcast.com.
Yeah. And send us your questions about this. So
right.
we can have an ongoing discussion about it. This is tricky. So, libido is it's like fragile in a certain way.
Mm-hmm.
And it's not so simple once people feel like they've lost contact to get contact again.
Right.
So we can continue to have these kinds of conversations and help people through some
Fantastic.
of this. And of course, this is, I hope that people, if they feel like they've lost touch with their libido, they talk to their doctor about it, just for general checkup too, not just testosterone,
right?
But other things that could be going on that could be hampering their style.
Absolutely.
Any number of reasons. Ways. So.
Excellent.
Okay.
Dr. Brandon, as always, a great pleasure.
It was great to see you, Dr. Morgentaler.
And thus ends another episode of The Sex Doctors. And I think all that's left is to say adieu.
Adieu.
Bye-bye.